All right, good evening, everyone. Thank you for coming. I'm Rob Stone. I'm the health educator for the Township of Montclair. And September is National Pain Awareness Month. And because of that, I wrote a proclamation that I got signed by the council, and they put it into action, recognizing September as Pain Awareness Month. And chronic pain, it affects a lot of people. And because of that, I wanted to do some sort of workshop on that. And so I'm very happy to have Davis Integrated here to talk on that. And right now I'm going to have Julia Sickler, my good friend, come up and do the introduction for our featured guest for this evening. So, thank you.
Thank you so much, Mr. Robert Stone, for that great introduction. That proclamation sounds fascinating and very important to the town of Montclair and New Jersey. My name is Julia Sickler. I'm going to introduce Dr. Davis. You may recognize us from Montclair TV 34's Live Life Well. We have about 6 episodes with different topics and subjects and guests on varieties of subjects in holistic healthcare. We have a yoga instructor on. We have a naturopathic doctor. We have a healthy cooking section. So make sure to check out our Live Life Well video series on Montclair TV 34 as well. Dr. Davis has been a natural health care practitioner for over 35 years in the town of Montclair. He's helped over 8,000 people become healthy and well naturally without the use of drugs or surgery. This is a very important subject to him because every single day, Dr. Davis and the staff at Davis Integrated Medicine dedicate their lives to helping people come out of pain naturally. So, Dr. Davis, he isn't just here to give you information on natural pain management. He's here to help you start to change your lives and the lives of people that you know and be pain-free. So please welcome Dr. Davis.
Thank you so much for that invitation. I want to thank you all for being here and being patient. Our talk tonight is on natural pain management. And my assumption is that probably most of you all are here because you are having some type of pain. Would that be correct? Yep, absolutely. Okay. And so you probably are all familiar with various types of painkillers and muscle relaxers to ease your pain. But we all know that there are some side effects to consistently and constantly taking painkillers, muscle relaxers, and anti-inflammatory drugs. So tonight's talk is going to be on natural pain management. What can we do naturally to be able to eliminate, reduce, or reverse the pain that you currently are having? Okay? Your nervous system is what basically transmits that pain. The nervous system is a complex collection of nerves and specialized cells known as neurons that transmit signals between different parts of your body. I'll never forget when I was growing up, I had a birthday and my mom made me a birthday cake, and she put a candle on it, and she lit it. And what did I want to do? I wanted to touch it, right? Maybe some of you all wanted to do the same thing, right? And so that was my first lesson as it relates to pain. I touched it, and I burned my finger, right? Pain is something that lets us know that something is not functioning properly in our bodies, okay? And so we have to take pain as not something that we need to suppress, something that we need to find out what's causing the pain so we can eliminate the pain. And that's what we're all about here tonight. And doing it naturally, without the use of drugs or surgery. Okay? Pain is a physical distress somewhere in the body. Nerves carry messages to the brain, informing the brain where the distress is. Now, there is something called referred pain, where you can have pain in an area that is not in the vicinity of where the problem is. Okay? That's considered referred pain. But in most cases, pain is going to be at the site or in the area where the problem is. Yes, sir? Referred pain. Yes, so in other words, you may have pain in your right shoulder blade, but the problem may not be in your right shoulder blade. The problem may be in the neck, radiating to that particular area. Okay? So referred pain is something that can occur. And that kind of many times confuses doctors because, let's say, for example, you say you have a pain in your right shoulder blade, but it's not the right shoulder blade that's the problem. Maybe it's something in the spine that's being pinched and irritated that's referring the pain over to the shoulder blade. right? So that can really kind of throw you off and force you to get the wrong treatment for a period of time because they're focusing on the shoulder blade when the cause of the pain is coming from the spine. So we have to be very, very careful in terms of properly diagnosing where the pain is coming from and what we need to do to be able to correct it or take the pressure off the nerves. Here we go. Okay. So, nervous system, made up of your brain and your spinal cord, okay, and all of the spinal nerves in the body. I always like to use the analogy of if we were to strip all the tissue away from your body, with the exception of your nervous system, we'd be able to identify each and every one of you all here in this room. The nervous system is just that complicated. It's just that complex, okay? And so, because the brain and the spinal cord transmit signals down that spinal cord from the brain to every organ, muscle, and gland in the body, it also can transmit pain, okay? And so what we're trying to do in natural pain management, we try to identify where in the spine, where in the nervous system there is a pinching or an irritation that's causing the pain, okay? It could be pain or pinching in the neck that's radiating into the shoulder and is traveling down the arm. It could be pain in the lower back that's traveling into the buttock and to the leg and all the way down into your feet. So, I mean, pain can radiate, it can travel, but the goal is to try to find out where the cause of the problem is, okay? Because if you just treat the peripheral of the pain, it's not going to correct the problem. But if you find where the cause of the problem is and you identify that and correct the pressure, take the pressure off the nerves, then you're going to be able to eliminate the pain naturally, okay? Now, your brain processes pain, okay? When you're in pain, the brain is aware of it. And so our goal is to not in any way block that transmission to the brain because you want to be able to feel, you want to be able to know what's going on. You don't want it to be blocked, okay? But the fact of the matter is that we want to be able to find out what the cause of the problem is so we can correct the cause of the problem and then eliminate the pain. The nervous system controls everything. In human development, when the egg is fertilized by the sperm, the first recognizable organ in that development is the nervous system and the spinal cord. It's called the nodal cord, okay? And that ultimately changes into the different organs and muscles and glands of your body. So the nervous system controls all other systems of the body. Health is all systems functioning in harmony. Okay? Let me repeat that. Health is all systems functioning in harmony. So if you have a, let's say, digestive system that has an irritation, let's say you're eating a lot of fried foods or maybe you are taking in a lot of food dyes or a lot of chemicals, whatever like that, and that digestive system gets irritated, it's going to send signals to the spinal cord telling it that there's an irritation there. Okay? The fact of the matter is that if that irritation is not eliminated by you changing your diet and improving what you're eating, that's now going to become an ulcer. And now you have even an additional problem. Okay? So you want to make sure that you're mindful of the nervous system controlling everything. The nervous system is kind of like that superhighway that sends signals from the brain and away from the brain, basically allowing your body to be able to function. Allows your digestive system to work, allows your circulatory system to work, allows the excretory system to work, respiratory. Everything is controlled by that nervous system. So when you talk about spine and motor function, right, movement is one of the primary signs of life. And any change in structure or function of the spine may adversely affect human movement. Okay? So it's important that we move our bodies. But when we're in pain, we are less likely to want to move. Right? So we become stiff, and that compounds the problem. The muscles will begin to atrophy. Okay? The nerves begin to malfunction. Right? So movement is something that's very, very, very important. Right? So even when you're in pain, you still want to try to move as much as you can. Because if you become stagnant or if you just stop moving, it's just going to make bad matters worse. Okay? And it's regardless of whatever you can do, whether it's you're getting into some water and moving, doing some water aerobics, right? Or you go out for a walk, or whatever it might be, you want to try to move the body every single day to be able to maintain that motion until we can figure out how to get rid of the pain. Causes of spinal cord injury, motor vehicle accidents are probably the largest category there, 36.5%. The whole action of someone sitting at a red light and somebody coming behind them and smashing into the back of them, or smashing into the side, or a head-on collision, that trauma to the spine causes 36.5% of spinal cord injuries. Right? Next, we have falls at 28.5%. And of course, as we get older, it's very important that we're very mindful about not falling, because our bones tend to become more brittle. Right? You've all heard the story of somebody, just kind of like stepping off of a curb, and what happens? They fracture their hip. Okay? And that's a problem. Okay? Because now you've got to go through, either the pins or the surgery to get the hip back into proper alignment. And then you got to go through all of the physical therapy that's required to be able to get the joint to move again. And so it's really something that's very devastating when an older person has a fall and has a fracture or fractures the hip. Violence comes in at about 14.3%. And then other and unknown, sports-related accidents, 9.2%. But these are all legitimate causes of spinal cord injury. Okay? And so we want to make sure that we are mindful of this, and we understand that the body was designed to move. Okay? It was designed to move. And when you begin to stop moving, either because of an injury or an accident or pain, your body's going to begin to atrophy. Your muscles are going to begin to atrophy. Your bones are going to begin to become osteoporotic and be more likely to fracture. So we want to keep the body moving, even if it's minimal movement. Our goal in terms of movement of the body is to try to allow you to do something every single day, 7 days a week, whether it's just walking around the block or getting into the pool or getting on a bicycle, a stationary bike, or a regular bike, whatever it might be. We want to keep your body moving, because movement is life. Structure determines function. Okay? And so movement is one of the primary signs of life, and any change in the structure or function of the spine may adversely affect human movement. Like that face there, right? It's painful. This is a schematic that basically shows you the different kinds of conditions or situations that can occur in the spine. So at the very top, you see a normal disc. You have a nice height. It's even. It's in alignment. No misalignment there. That's the way it's supposed to be. It's hydrated. So when a disc is normal, it has a lot of fluid in it. Okay? When a vertebra, which are these brown things that you see here lined up in your spine, when a vertebra moves out of alignment, it causes the disc to begin to degenerate. And that's when the disc begins to lose its water content. Right? When a disc begins to degenerate, it can cause pain, because the opening that you see right behind the disc there, that opening is where the nerve comes out of. And if those two vertebrae begin to come closer and closer together because the disc begins to degenerate, that nerve is going to become severely pinched and irritated and cause pain. The next example is a bulging disc. This usually occurs as a result of some kind of fall or injury or accident, some kind of trauma. Okay? And so when the vertebra moves out of alignment and the disc actually bulges, you can see how that bulge actually moves into the opening where the nerve comes out of. Okay? The nerve is very, very delicate. So that bulging that comes out from the disc is now pressing up against the nerve. If it's in the neck, it can cause pain to go into your shoulder, down your arm. It can cause numbness and tingling on your fingers. If it's in your lower back, it can cause pain going into your hips and your buttocks and down your leg. It can cause numbness and tingling in your feet. Okay? Herniated disc is the even more serious situation, because now that bulging becomes larger. Okay? And we've all heard of somebody herniating their disc. And what happens is that when that disc herniates, a lot of the disc begins to move out between the two vertebrae, and as a result of that, that bulge or that balloon that you see there now presses up against the nerve. And if you're still moving your body, you're still walking, you're still doing things, that bulge and that disc are going to get thin. Hence, that's what you see next, the thinning disc. The disc material now, as it bulges out, it begins to cause the disc to get thinner, and ultimately, in the last lower part there, you see disc degeneration, you see osteophyte formation. Osteophytes are those little points or those additional amounts of bone that are put there to make it stronger, but ultimately it causes more of a problem because those osteophytes, or that bone, actually protrudes into the nerve hole opening where you can see right there, and it actually creates more pressure on the nerve. So initially it's a good thing for that to occur, but ultimately it causes more of a problem, and it causes the bones to literally begin to fuse together. Once those two bones fuse together, there's nothing that you can do to take them apart. Okay? Once they fuse together, that's it. Okay? So the most common remedy for arthritis and joint pain includes non-steroidal anti-inflammatory drugs known as NSAIDs. You all have heard of those before, right? Okay? Such drugs as ibuprofen, Aleve, and Vioxx, which they took off the market because they killed too many people, fall under this category. These drugs have been found in numerous studies to cause heart attacks, strokes, kidney failure, and death. Okay? So nothing in the world wrong with you taking a non-steroidal anti-inflammatory drug for a short period of time. But any kind of extended use of any of these medications is going to cause multiple problems. As you can see, it can cause heart attacks, it can cause strokes, it can cause kidney failure, and it literally can cause death. Okay? So you don't want to be feeding yourself these non-steroidal anti-inflammatory drugs like they're candy. Okay? Yeah, for a short period of time, they're fine. But the fact of the matter is that the longer you take them, the more damage they can do to your stomach, to your heart, to your kidneys, and ultimately can cause death. We now know that overdoses from prescription opioids are a driving factor in the 15-year increase in opioid overdose deaths. The amount of prescription opioids sold to pharmacies, hospitals, and doctors' offices nearly quadrupled from 1999 to 2010, yet there had not been an overall change in the amount of pain that Americans reported. Deaths from prescription opioids drugs such as oxycodone, hydrocodone, and methadone have been more than quadrupled since 1999. And that's huge. Okay? So if you're taking some of these medications, be very mindful of the fact that you can get hooked on them. Okay? You can get hooked on them. Right? So any kind of medication you're taking, you always want to make sure that you take it in moderation, take it only if you need it, and if you don't need it a particular day, the recommendation is not to take it. 91 Americans die every day from an opioid overdose that includes prescription opioids and heroin. So it includes the illegal drugs, but also includes the prescription drugs. 91 Americans every single day die from this. And this is why the state of New Jersey has put a whole campaign out trying to eliminate the overdosing of opioids. Improper motion and posture causes misalignment and restriction of the spine that causes inflammation. Movement restriction and interference with the nervous system. For example, if a garden hose gets twisted or stepped on, what happens? Okay? The water stops flowing, and if you take away the interference, the water begins to flow freely. If you remove or correct the subluxation or the obstruction in your spine, the information from your nervous system can travel freely and allow your body to heal at its optimal performance. So this is an analogy that I've been using probably for over 20 years, the garden hose analogy, right? When you're talking about nerves sending signals from the brain down the spinal cord and out to every organ, muscle, and gland in the body, the best way for me to describe it is it's just like a garden hose that has a knot in it, right? You turn the water all the way up, it should be coming out nice and forcefully, but there is what we call a subluxation or an impingement in the nerve that reduces the amount of water that comes out. So if you're talking about watering your flowers, that reduction in water is now going to allow the flowers to begin to die and turn brown. The same thing happens in your spine. When the nerve is being pinched and irritated, it cuts off the nerve supply. Whatever that nerve is going to, whether it's your kidney, your stomach, your heart, your liver, that organ is going to begin to die a slow death, right? Which is why it's so very important that you maintain good posture and maintain good motion, right? So I'm not going to look, because people always begin to correct their posture when I do this, but if we're looking at you from the side and you're sitting there, your head should be over your shoulders, right? Your ears should be over your shoulders, right? If you were standing, that same plumb line should go through your elbow, should go through your hip, should go through right the back of your knees, should go through your ankles. That's what we consider good posture, okay? And so structure determines function. If you maintain good posture, your health is going to improve. I don't know why in the world they took away the posture classes in our schools, right? It used to be postural. How about all of you all who are of a certain age probably had posture classes in school, right? They eliminated it, right? That was one of the best things that they could have done to children and to kids, school-age kids, to be able to teach them how to maintain good posture, okay? So stress in your nervous system. Stress is the body's reaction to a change that requires physical, chemical, or emotional adjustment or response. So let's talk about this for a second. You can have a physical trauma, which means you could have a fall or an motor vehicle accident. That's what we call a physical trauma that can knock something out of alignment and cause nerves to be pinched and irritated. You can have chemical reaction. Let's say you like to drink soda, right? All of the sugar in there is going to irritate your nervous system. It's going to cause a problem, right? Fried foods is going to cause irritation, okay? Junk foods is going to cause irritation. So you want to try to make sure that you keep yourself as clean as possible, and you don't take things that are not natural or have artificial sweeteners and artificial chemicals in it. You want to try to avoid that as much as possible. Emotional, somebody passes in your family, right? Your child gets injured, okay? These are emotional things that can play a huge role on creating stress in your system. So stress can be positive or negative. Most people, when you talk about stress, they think of it only as negative, right? There can be something called eustress, which is positive, but unfortunately, when we talk about stress, we always talk about the negative. So all of these can harm the spine, okay? All of these can harm the spine. So we take these three categories, physical, chemical, and emotional. We want all of you all here to be mindful of the fact that these three categories can cause stress to your body. And you have to do things, you have to begin to do things that are going to neutralize that stress. If not, it's going to have an impact on your body. Okay? So I believe that each of you all has our stress survey. We'd love for you to be able to fill it out. Just fill out the top. And then we want you to check off those things that may be bothering you. Okay? If you're under a lot of stress and you're not handling it well, check off the box that says stress and anxiety. If you have a headache, I mean, it's only normal to maybe have 2 to 3 headaches at the most per year. Okay? We had a young lady in the office today. She gets like 3 to 4 headaches per week. Yeah, that's a lot. Okay? But if you're getting more than 2 to 3 headaches per year, check the box. Maybe you have sleeping problems. Maybe you go to bed and you just count sheep. You're not able to go to sleep. The normal sleep is 7 to 9 hours. Okay? If you're getting anything less than that, or if you wake up in the middle of the night once or twice or 3 times, that's a problem. Your body's not able to heal. Thyroid issues, digestive issues. You eat something and you have gas, or you feel bloated. Sinus problems, ringing in the ears, weight trouble. Most people who have a weight issue usually are overweight, but you also have situations where people are underweight. Okay, that happens less, but weight is an issue. Diabetes, joint pain, arthritis, fatigue, neck, middle back, and lower back pain, blood pressure issues, cholesterol issues. And if there's something that's not on here that you'd like to put down that you're dealing with, please write it down on those 2 lines that we have underneath there. Okay? So stress can cause nerve damage. It can be caused by toxicity. And so this health survey allows us to be able to identify what are the effects of the stressors that you're having in your life and in your body. So this is a dashboard to a car. It all looks familiar to you, right? But you see it says check engine on it. Everybody see that down at the bottom there? It says check engine. All right, what does that mean when your car says check engine? Yeah, you got to take it to somebody who's knowledgeable to be able to hook it up to a machine to be able to see what the problem is. Now, it could be the engine, could be the radiator, could be a lot of different things, okay? But that's the signal or the warning sign that says something is wrong with the vehicle. You need to take it in and get it checked. So let's translate that into humans. Do you have a symptom? That's just like the check engine light. A symptom is a sign that something is not functioning properly in your body and you need to get it checked, right? Don't ignore it. Don't ignore it. Even if it goes away, don't ignore it, okay? Because it only comes on when there's something that's wrong. If I can show you guys today how to get rid of your problems by doing something natural and affordable, would you do it? Raise your hand. Well, y'all been too still here. Raise your hand. Yeah. Movement. Okay? Take a look at the solutions. Injury prevention techniques. Injury prevention is possible if you are prepared for your activity, physically and mentally. Okay? It has to be physical and it has to be mental. If you're physically fit, but you're not mentally prepared, you're going to have an injury. If you're mentally prepared and not physically prepared, you're going to have an injury. Right? And this is just not for athletes. Okay? This is for anybody. Anybody. Immediate injury treatment. If you suffer an acute injury such as a strain or a pull, immediately stop the activity and use the RICE method of treatment. Well, what does RICE stand for? Raise, ice, compress, and elevate. Right? You should do it as soon as you possibly can to reduce the swelling, to reduce the injury. Okay? Try to get that ice on there just as soon as you possibly can to reduce the inflammation. When to see a doctor? Well, after any type of car accident or fall, any kind of pain, any pain that's radiating out, so pain coming from the neck, maybe it's going down the arm into fingers, pain coming out of the lower back, traveling down the arm, the legs into the feet, any kind of pain, you should get it checked out. Point tender, say there are certain areas of your body that you touch and they're tender. You touch the right arm and it feels fine, but you touch the left arm and it feels more tender. Okay? That's not normal. It's not normal. Significant swelling means that there is some kind of irritation. Okay? Something that you can't move. Okay? Many times people are involved in a motor vehicle accident, they suffer from a whiplash, and then immediately what happens is the muscles in the neck begin to tighten up. If it gets really severe, it's called torticollis. Can't move your head. Why? The body has a protective mechanism because the blood vessels and the nerves have been injured from the whiplash, so the body protects it by splinting the muscles so you can't move them. If you could move them, you probably would kill yourself. Okay? So you have to be mindful of the fact that your body's looking out for you. Persistent numbness. Numbness in the feet, numbness in the hands, numbness anywhere. An injury or a wound that does not heal in 3 weeks means that something is wrong. You need to get some kind of professional help. Right. The importance of good posture. Okay? This basically shows, in the first 4 examples from left to right, what bad posture is. The last one shows you standing what good posture is. And as I mentioned, when you're standing properly, the plumb line should go through your ear, through your shoulder, through your elbow, through your hip, right behind your knee, and right through your ankle. Okay? That is considered good posture. Sway back, the shoulders are going back. Lumbar lordosis, the curve in the lower back is increased. Thoracic kyphosis, the middle back is curving more than it should, so the shoulders come forward. Forward head posture is something that probably about 90+% of the population has. People are just standing and their head is in front of their body. Bring your shoulders back. Keep your head over your body. Your head weighs about the same weight as a bowling ball. I mean, how many bowlers do we have out there? Anybody? It's a couple of bowlers, right? So you're talking about somewhere between 8 and 12 pounds. Okay? When that head is just 1 inch in front of the body, it's putting a huge amount of stress and pressure on the muscles of your neck and also of your shoulders. Okay? If you have a sitting job, or if you sit at home and you're on the computer, you want to make sure that you have the proper type of chair. You want to make sure that your viewing distance is 18 to 24 inches, about arm's length. You want to make sure that your screen is nice and high so you're looking straight, you're not looking down. You make sure you have a nice lumbar support for your lower back, okay? Because the curve in the lower back goes forward, just like the curve in the neck goes forward. The one in the middle back goes backwards. So you want to make sure you have a nice supportive lumbar cushion in the lower back. You want to make sure that the angle of the legs and the knees is either 90 degrees, or if you can put your feet up on something and bring the knees slightly higher than the hip, that's even better. It takes a lot of the stress off of your lower back. Okay? Biomechanical factors include posture and misaligned joints, to name just a few. An imbalanced posture can cause certain joints to carry more weight and wear out. Why are we having such a predominance now of people who are having knee problems? Knees, the cartilage is wearing out. Usually it's on one side versus the other. Okay? Hip replacements. Hips are wearing out. Why is that happening? That's because of imbalance. It's because when you're standing, the hips are not even. One side is higher than the other, putting more pressure on the cartilage in the knees, putting more pressure on the cartilage in the hips, and ultimately it just wears it out. So a couple of tests. With your arms at your sides, and you can do this sitting, arms at your sides, bend your elbows so that your palms are facing the ceiling. Rotate your hands until your palms are facing the floor. There should be no pain doing that at all. No pain in your elbow, no pain in your wrist. If you have pain in your elbow, it may be some type of elbow epicondylitis. If you have pain in your wrist, it could be an impingement of the nerve in the wrist area, carpal tunnel. Test your wrists. Put the backs of your hands together while keeping your arms parallel to the floor and your fingers pointing down. Hold it for a minute. Okay? If you begin to feel pain in your wrist, chances are very good you have some type of carpal tunnel issue. Okay? These are all tests that you can do to be able to see if you have a problem. So let's talk about some foods that are anti-inflammatory, right? We all want to reduce inflammation. And these are my 28 superfoods, right? These are foods that reduce inflammation, provide healthy nutrition for your body, right? Now, most of these foods are on the index of being anti-inflammatory, very highly anti-inflammatory. But there's one food on here that has the highest rating as it relates to anti-inflammatory and being healthy for your body and providing phytonutrients. Somebody know what that is? Yeah. Everybody heard that? Kale has the highest rating in terms of nutrient density. Okay? Kale, all these are very, very good for you, but kale has the highest rating of nutrient density. Right? So, how many of you all go and do your grocery shopping on a weekly basis? Quite a few of you, right? So, you want to try to purchase these types of foods, and you'll notice that most of these foods are going to be in the produce section, right? On the wall, produce section. So when you're doing your food shopping, you have to understand that you want to try to stay around the perimeter of the supermarket. That's where all of the fresh stuff is. That's where you have to plug the refrigeration in to keep it fresh, right? When we go down the aisles, now you're beginning to look at things that are processed, more so. Okay? So you want to try to spend the majority of your time in the supermarket around the perimeter of the supermarket where there are things that will spoil if they're not refrigerated. Okay? You've all heard of the dirty dozen. The dirty dozen are those foods that are easily invaded by pesticides and herbicides. Okay? This is something that was developed back in 2013, but it's still very, very true today. The dirty dozen are fruits and vegetables that have very porous skin. So that strawberry right there can easily be infiltrated by a herbicide or a pesticide. When you take it home and you wash off the exterior, are you getting rid of the herbicides and the pesticides? No, because it's gone into the fruit. So these foods called the dirty dozen, these you want to try to purchase as best as you can, either organic or from like one of the farmers markets or something like that, where it's going to be a lot healthier, where they don't spray all of these chemicals on it. The Clean 15 now, you can be a little bit more relaxed, because the Clean 15, these fruits and vegetables have a tougher skin. Like look at that onion right there, right? You can spray that onion. It'd be very hard for anything to penetrate the skin of that onion, right? And you can peel it, and you'll be free and clear of any kind of issues there. Okay? So remember the Dirty Dozen, Clean 15. Dirty Dozen, you're going to try to buy organic. Clean 15, you can be a little more relaxed. If you can afford and get these organic, then you're still good to go, because they're going to have more vitamins and minerals in it. But if you're on a budget like I am, the Clean 15, you buy them non-organic. Okay? And you all know how it's labeled, right? If something is organic in a supermarket, it starts with the number 9. Okay? If it's not, then it's going to start with another, either a 4 or a 7, the ones on the right. So when you're doing your grocery shopping, you really have to be able to spend time to be able to understand, what the designations are on the fruits and vegetables. Turmeric. It's a natural pain medication. You can obtain it at vitamin stores. Devil's Claw, St. John's wort oil, arnica. Some of you all are familiar with some of these already. These are natural pain relievers. So if you can avoid having to take prescription med and use some of the more natural pain relievers, it'll be a lot healthier for you, a lot less side effects, probably no side effects with the natural painkillers. So, a cell phone call, now everybody here has had a dropped cell phone call. When you're on the phone and all of a sudden you're talking to somebody and all of a sudden the phone drops, that is communication. The communication is broken down. The same thing can occur between your brain and your nervous system and those nerves exiting out of the spinal column. Understand that your body communicates through your brain. The brain sends messages down your spinal cord and out through 33 pairs of nerves that go to every organ, muscle, and gland in your body. You can see the nerves that are coming out of the neck area are beginning to travel down the arm. The nerves in the lower back are beginning to travel down into the leg all the way to the feet. So it's important that every organ, muscle, and gland in your body receives the proper communication from the nervous system. If you've had a fall or an injury or an accident, those vertebrae can get twisted out of alignment, cause the nerves to become pinched and irritated, and interfere with the communication from the brain. And remember, it's a two-way street. The brain sends signals out, but the brain also receives signals back in. Okay? And so if there's an irritation in any of these spinal nerves, it's just like a dropped call. Yes, sir. That is usually the 3 lowest vertebrae in the lumbar spine and the lower back, L3, L4, and L5. Those nerves basically come together and travel all the way down your leg into your feet. Okay? And those are the ones that are in the lower part of the spine. Okay? So, tips for back health. Exercise regularly. Let me ask you all a question. How often should you exercise? Every single day. No holidays for exercise. Get out, go for a walk. If you can get into a pool and some water. If you have arthritis and you're in a lot of pain, many times getting in water is a lot less painful because you're more buoyant. So you can move your body for a longer period of time and not have to have that weight bearing because the water keeps you buoyant. Maintain good posture. We talked about posture a couple of times today, so we want to make sure that everybody who's in this lecture, anybody who's hearing this workshop, is going to begin to maintain good posture. Shoulders back, ears over the shoulders, elbows, hips, knees, ankles. Try to maintain good posture. Try to teach your children to maintain good posture, right? A lot of times they have their kids, they're carrying a lot of books back and forth to school, and sometimes I ride by and I see their kids and they're just like, you know, they got the backpack on and they're carrying all of these textbooks and their posture's terrible. They're going to end up with problems very soon. So we want to maintain good posture, keep the shoulders back, keep the head in alignment. Stretch your spine before and after sports. And when I talk about stretch your spine, if you're not doing any sports, you should stretch your spine when you wake up in the morning. Before you even get out of bed, you should stretch. You ever seen a cat stretch? It's a natural occurrence. You should stretch before you start your day, right? You should stretch before you go to bed at night. You should stretch. Stretching is something you should do at least twice every single day. If you can get another one in there, that's even better. But you want to stretch before any kind of activity. You want to stretch in the morning. You want to stretch at night just to keep your joints nice and limber. Okay? Here we go. Don't overload your backpack or your shoulder bag. We have a thing in our office where, excuse me, when a female patient comes in, and I've had some heavy ones recently. I mean, and the bag is like this big. It's on her shoulder. She can hardly lift it. She puts it up on a hook in our office to receive her care. And I look at her, I'm like, why are you carrying all of this stuff around? Don't try to hide your purses, ladies. I already saw him. I already saw him, okay? So you want to try to lighten your load. You know, obviously if it's a backpack and you're in school, you got to carry a certain amount of books around. But ladies, shoulder bag, come on. You're not going to use all of that stuff, right? And so one of the things we do in our office is, you know, I do like, you know, like bag checks. Like if I see a bag that's too heavy, I grab it. I'm like, listen, what can you take out of here that you're not going to need today? And usually when they start taking the stuff out, it's nice and light. Because see, we're all creatures of habit, right? If you have a shoulder bag, you generally put it on the same shoulder all the time. Same shoulder all the time, right? We're creatures of habit. So what happens? Your body, if you put it on this shoulder here, the body's going to automatically be tilting to the side. Okay, and the heavier it is, the more of a problem it's going to cause. Okay? So if you're carrying a shoulder bag, remember to alternate. Put it on the right side, put it on the left side, switch it back and forth. Don't put it on the same side all the time. It's going to cause your spine to begin to tilt. Stretch your legs and back after each hour of sitting. If you're sitting at home, if you have a desk job, you want to make sure that you set a timer so that, and it can be 30 minutes, but we just have it here as an hour. 60 minutes, you need to stand up. You need to stretch, right? You shouldn't be sitting any more than 40 to 60 minutes at a time. Never cradle the phone between your neck and your shoulder. So I was going to give you a number, right? And also you put it right here. You start doing this. That causes neck strain, neck problems. Okay? So these are all things that we can do to be able to try to avoid these injuries. Sleep on your back or your side, not your stomach. Okay? Sleeping on your stomach causes the spine to become deformed. Right? The belly pulls the spine out of alignment. When you're on your stomach, you have to turn your head either to the right or to the left. Puts a lot of stress on your neck and on your shoulders. Right? Plus, when you're sleeping on your stomach, it's compressing your chest. Well, what's up in here? Your heart and your lungs, right? So you're not able to breathe deeply, and it's also putting stress on your heart, right? So either on your back or on your side. When you're on your back, take a pillow, put it underneath your knees. One pillow underneath your head, not 2 or 3 or 4, okay? And the head should kind of tilt backwards a little bit to accentuate that normal curve in your neck. Elevating the knees is going to take a lot of stress off your lower back, right? If you want to sleep on your side, that's fine. Just make sure your spine and your head are in alignment. So you have to actually have somebody to check you when you're in the side position to see if you're nice and straight. You want to put a pillow in between your knees. That's perfect because that takes a lot of the stress off your SI joint in the back. So pillow between your knees. Pillow only thick enough to be able to keep your spine in alignment while you're lying on your side. Too many pillows is going to push the head up. No pillow is going to push the head down. Okay, so you need to have a pillow that's thick enough that's going to keep you in alignment. Invest in a good chair, pillow, and mattress. Very important. If you have a desk job, make sure you invest in a good chair that gives you support in your lower spine. Your pillow, very important. We provide cervical pillows in our office, and people that people have somebody have never seen a cervical pillow. A cervical pillow is a pillow where it has a depression in the center, and the sides are a little bit higher. So when you sleep on your side, put your head on the side. If you sleep on your back, put the head in the center, and it allows you to be able to naturally curve that neck while you're sleeping on your back. Very, very comfortable. And then your mattress. Okay, if you allow your mattress and the middle part of your body is sinking down, that means that the mattress is not firm enough. Either put a piece of 3/4 inch plywood in between the mattress and the box spring, or just get another mattress. Okay? You spend about 1/3 of your life sleeping, so you want to make sure that when you're sleeping, your spine is properly supported. Okay? Hold on, I think he has to come with the microphone. Sorry. This young lady right here.
What is your opinion on desk risers?
On desk risers, I think they're great because they give you the opportunity to be able to either sit or stand and work, right? So you're talking about with the desk that rises up and you can stand. I think they're wonderful because the human body was not designed to sit for extended periods of time. And when you're sitting, you're putting more stress on the disc in your lower back. Right? When you're standing, you're relieving a lot of that pressure off the lower back. So I think it's great. Okay. All right, and of course have regular spinal checkups. Okay. End result of physical stress always results in a healthy nervous system. This is our integrated pain management clinic. How to treat back pain naturally without drugs. We have wellness consultants, physical therapy, regenerative medicine, which is an up-and-coming field that we're doing in our office. People who have degenerative knee problems, acupuncture, massage therapy, chiropractic, nutritional supplements, weight loss management, also spinal decompression. And you have the car accidents. Okay? How many people have been involved in at least one car accident in their lifetime? Look at those hands. Trauma to the spine. Okay? Trauma to the spine. You need to get checked. Proactive versus reactive. The future is just a day away. Take the steps now to improve your health. Who would you rather be? Somebody who's walking around with a cane, who's not having any fun? Or somebody who's down in the islands in the hurricane? No, I'm only joking. This is our holistic services again. We are Davis Integrated Medicine. And this is the time where we stop for questions. Right up here. I'm going to keep you busy tonight.
Do you offer mindfulness, meditation, and aromatherapy also in your offices?
Yes, we have. Well, we try to have the aromatherapy in the office all the time, just to be able to have a nice, comforting, relaxing type of scent in the office. But yes, we do have other professionals that come into our office that provide those other services. Yes. Any other questions at all? Yes, over here. Question? Gentleman over here. He's coming.
Thank you. My question is concerning C4, 5, and 6. If the situation was by bone graft infusion, C4, 5, and 6 combined, whereas I'm sure you could probably tell me exactly what's going on in a 20 to 25-year-old bone graft infusion of C4, 5, and 6. What would be the best suggestions to deal with that?
Now, are these the C4, 5, and 6 fused?
Yes.
They're fused. Okay. So in a situation like that where you have, and what he's basically talking about is 3 vertebrae in the neck, because you have 7 vertebrae in the neck, C1 through C7, right? You talk about C4, 5, and 6 being fused?
Yes.
Okay. So your whole goal there is nothing you can do about C4, 5, and 6, because that's fused. Nature's taken its course, and it's fused. But what you want to do is you want to make sure you keep 1, 2, and 3, and 6 and 7 moving, okay? Because by doing that, you're still going to be able to have some range of motion, being able to turn, to extend, and also to flex. Okay, so you want to, because what naturally happens is that when you have vertebra fused in the spine, whether it's in the neck, in the middle back, or the lower back, the natural tendency is the spine will just continue that fusion process if you're not moving it, if you're not receiving the proper type of therapy for it. So you want to make sure that you maintain the motion of the ones that are not fused so that you can at least maintain some rotation, extension, and flexion. Okay? Excellent. Thank you. Any other questions at all? Yes, ma'am. Oh, we have you running, man. We need like a clone of you. One on one side and one on the other.
Hi. You spoke of the bulging disc and all of the other disc problems. Is there a natural approach to alleviate the pain and to correct it, or is that something that needs surgery, or just in general, like what do you do for that?
So when a person comes in with one of those deformities that we talked about, either the disc is degenerated, or it's herniated, or it's bulging, or whatever it might be, our charge is to try to avoid any kind of surgery, right? And so being a natural healthcare provider, we have modalities in our office that help us to be able to avoid the person going in and having surgery. Because we know that once a person goes in and has surgery, the person is cut, ligaments are cut, muscles are cut, instability occurs, and it usually requires another surgery, and then maybe even another surgery. So we work very, very hard in our office to try to avoid. It's not always possible, okay? We work very, very hard in our office to be able to avoid surgery and to use natural methods, whether it be adjustments or acupuncture or physical therapy or massage therapy, whatever it might be. We try to use natural methods to be able to try to avoid surgery at all costs. And I would say that probably in my 35 years of practice, we've probably been very successful. I would say we probably have maybe referred maybe 3 to 5% of all the people that we've ever seen in for surgery. So that's a pretty good ratio. 95% of people we've been able to save from having to have any kind, having to be cut. Okay? Thank you for your question.
My question is regarding what are your feelings or thoughts on how New Jersey is taking steps to institute the medicinal marijuana programs instead of dealing with those who don't want to do the NSAIDs or synthetic opiates because of its damage to the organs, as well as in some cases its lack of just healing or repairing the actual injury itself.
I'm still investigating that. I am somewhat familiar with what you're talking about. I think that a natural approach is going to always be better. So if you are providing people who really are looking for pain release and they don't want to take all of the opioids to get addicted and all those other types of medications, I think that is certainly an alternative for some people. Now, it's not for everybody, but I think it's certainly a good alternative for some people. So I'd be in favor of, continuing that process. I mean, obviously, I'm not really too familiar with, how it's dispensed and all of those kinds of things, but I think that, if you can utilize, anytime you can utilize a natural substance versus something that's chemically made or man-made, you're always going to be better off. Okay. Any other questions? Yes, ma'am.
And yeah, I saw on the sheet that you said that you do go to other places. I actually work at a partial daycare program for the mentally ill in here in Essex County in Orange, and I would love to have you come to present because we really need the kind of information that you have. So do you do that, and do you charge for that kind of thing, or how does that work?
No, we work under the Foundation for Wellness Professionals, which is a nonprofit So that umbrella allows me to be able to go out and do talks without having to charge groups any type of fee. And, you know, I've been doing this for so long. You know, my passion is to be able to help people naturally. And so I'd be more than happy to be able to, you know, come out and speak. Julia, my community relations person, speak to her. Our schedule is actually filling up for the rest of the year, but if we can arrange to be able to come out and speak to your group, we'd be more than happy to do that, and we don't charge any fee for that. Okay, thank you.
Last question.
Last question.
If you know that in the spine, 1, 2, or 3 are fine, that show up fine on an x-ray, but you have arthritis in 11, 12 area, how do you keep that from spreading?
So I'm assuming that you're talking about the thoracic spine? Okay. And you said that, I'm sorry, which ones were being impinged upon?
Arthritis is showing up in 11 and 12.
11 and 12, okay. So that's right above the lumbar. Just so that you all know, just so everybody knows what I'm talking about. So there's 7 vertebrae in the neck called cervical. There are 12 in the middle part of the back called thoracic, and there are 5 in the lower back called lumbar. What she's referring to the last several segments in the thoracic spine. Now, the thoracic spine is a little bit different from the cervical and the lumbar because the thoracic spine is connected to the ribs, so it makes it a little bit less mobile. But what researchers are finding out is that a lot of problems that occur both in the neck and also in the lower back are originating from the thoracic spine. So even though it's restricted and the ribs kind of keep them from moving as much as the ones in the neck and in the lower back, our research is now showing that a lot of problems for the neck and the lower back are originating in the thoracic spine. So your question is very appropriate. In terms of T11 and T12, which are the last 2 vertebrae in the thoracic spine, obviously we'd like to be able to evaluate it to see if there's any loss of the disc, if there's any fusion. It's not fused together yet, is it? So as long as the 2 vertebrae are not fused together, there's hope. There's hope. When the bones actually fuse together and grow together, there's nothing that we can do. So if you have even a little bit of a thin disc space, whether it be in the cervical spine, the thoracic spine, or the lumbar spine, there's hope, and we can begin to get it back into alignment and stop that process of the disc degenerate, because the disc only degenerates when the vertebra is out of alignment. So something probably occurred to kind of knock that out of alignment, correct? Okay? All right? Could have been a fall, could have been an injury, could have been an accident. Something causes it to knock out of alignment, and that's what causes the disc to begin to wear down. It's the same analogy I'll use if you're driving a car and your car is out of alignment. Have you ever seen the cars like they're going down the street sideways, right? Well, that is putting an unequal amount of pressure on the treads of the tire. So when that happens, the one side of the tire tread is going to wear out, the other side is going to be completely normal because it's not flush to the ground. It's tilted. Same thing with your spine. So if those vertebrae are out of alignment and it's wearing out those discs between T11 and T12, we need to reposition those vertebrae so it can stop that wear and tear. Okay? Excellent. So thank you very much.
Thank you, Dr. Davis, for coming out, and this concludes it. So round of applause for Dr. Davis. I'd like to thank our audience for coming out this evening and our online viewers. And again, pain management is very important, and I'm thankful that we have Dr. Davis, that he was able to talk about natural ways to alleviate pain. So again, thank you so much.
Thank you very much for having me. Can you continue?